Like,
Yeah, I mean that's fine. Uh, everybody has these problems, but what I
hmm,
suggest is since no, I'm very serious on it. I'm next
hmm,
1 2 years you will see like AML
hmm.
uh, in almost all domains.
Yes,
Like
yes.
yeah, earlier it was in basically the retail and the service segments, but
Hmm.
now you see the AML even entering into the regulatory domains. Okay,
Yes.
where you have regulations or regulatory compliance.
Hmm.
I mean, there are a lot of updates that are happening from
Hmm.
From Europe and US, also
Yes.
from the Cdisco,
Hmm.
that making these ML platforms, okay, with new regulations compliant uh, in almost all of healthcare segments, right?
Yes.
Making it
Yes.
in medical devices, and mostly what I feel is I have some intelligence reports from some couple of my friends who are in business intelligence.
Hmm.
They say like in next 1 2 years you see lot of AI enabled medical devices,
Hmm.
okay, that are connected through AIML, whether it's IoT or some ML
Hmm.
platform.
Hmm.
Okay, that devices will come out. That will be more, whether it's for monitoring or for
Hmm.
diagnosis
Hmm.
or
That's
for
right.
decision making, or not decision making, as decision support systems.
Yes, yes, yes.
Okay, they won't take this because they can't be autonomous.
Hmm. Yesterday, I was having a meeting with the DNV, Global Notified Body Team.
Okay.
Yeah. So, somewhere I have gone through the IMDRF, where IMDRF is proposing EU and US Safety Authority um,
Okay.
to expedite the technical review or clinical review.
Yeah.
They would like to take support from AI and ML.
Yeah,
Uh,
that's very true. Yes.
so I was telling that person Alexis, so he admitted he's the president for this council, and he was telling me that yes, it is quite true. Very soon we have to come up with this to expedite the technical review process.
Yes, yes.
So my my submission to him was like, then you have to give me the terminologies that you are trying to find out through AIML.
Yeah.
Because if I'm missing out on these terminologies, NC will be automatically come into my bucket. I
Yeah.
don't want that. Yeah. So,
Yeah, actually, I mean, I'll share it personally to you. Oh, I mean, we have a glossary, I mean, like the terms and definitions for all the important, I mean, vocabulary that we
ah,
use in AIML.
yes,
I
yes.
shared it already in the group. What I'll do is I'll share it personally on your WhatsApp so you
Ah,
can understand what is the terminology used basically.
yes, yes, yes. That
Yeah.
will be a great help. Yeah.
Yeah, and as I said, no, most in next 1 2 years, you see almost all medical devices connected to AML
Hmm.
or AML enabled.
Yeah.
So now in the next 1 year, what's happening is uh, almost all the regulations, I mean, all country regulations. I mean, if this basically starts from the West, either it's in Europe or in US, it starts and slowly it percolates or to the other countries. So it's already started that the new regulations or already existing regulations have been amended. So these regulations could have a lot of things on mainly explainability, validity, okay, trust on the decision support system, the monitoring systems, the diagnostic systems. Okay, I mean, yesterday only I shared one on Arulmati also joined. She knows she's from living in Canada. There are regulations from Canada also that came on like how AI should be integrated with medical devices. And the second thing, I was having, I was a guest speaker yesterday for an AA summit,
Okay.
uh, mainly on democratization of AI in healthcare.
Mhm.
In okay, that is linked to Viksit Bharat Vision
Uh-huh.
2047.
Okay.
So I was giving a talk like uh, for an 45 minutes or 1 hour.
Mhm.
Basically, they answered. What I understand is like it is already happening. Like we are not starting anything from scratch.
Mhm.
Since last 2 years, there is a lot of build-up that happened on AI infra and
Mhm.
also regulations, mainly the AI Act, Ayushman Bharat, Mission
Mhm.
AI, how fund has been allocated. And you see in this budget, I mean, on Sunday, what Nirmala Sitaraman, she was, I mean, they were focusing on three things. One is on AI,
Mhm.
on healthcare system, and also in other domains.
Mhm.
Second is on semiconductors.
Mhm.
Okay, and the third was on rare earths. Rare earths. So I mean, most of the budget was allocated on these three: AI,
Mhm.
semiconductors, and rare earths. Of
Okay.
course, I mean, there was for you, like for women entrepreneurs, there were a lot of fund allocated. Maybe I'll
Mhm.
share with you if you need.
Mhm.
Women entrepreneurs or who want to have their own startups, or if there are startups further to have their SMS, I mean, MSMEs further,
MSME. Yeah.
SMEs further for their funding. Okay,
Mhm.
yeah, there's a lot of things that are happening.
Yes. Yes. Yes.
Uh, you will be, I'll share the summary of the budget, what was allocated on that Sunday for only AI. You will be
Mhm.
surprised to see that.
Every segment is.
And as I said, no, yesterday was giving a talk on AI Summit. What I understand is like there are three special population where we need to focus. Basically, I mean, in the initial stages when we are integrating or democratizing the AI in the healthcare.
Mhm.
Yeah, first comes is the geriatrics.
Yes.
Yeah,
Mm.
old
Yes.
people. And second comes is the pediatrics, not necessarily pediatrics, basically the neonates,
Okay.
okay, the newborns. Uh,
Mhm.
Third population is the pregnant women.
Okay.
Okay, so these are special category of population which will be viewed first in when you are integrating this AA with healthcare. These three special population has to be taken care first. Okay, then we can move to other sections like whether it's elderly or it's pregnant women or it's pediatrics. Okay, I mean, I will tell you during the discussion that I have democratized an app which in a month or so it will come, it will be open. Like it will be, you can download it from Google Store or Play Store. It's like cardiac risk prediction in Indian population. I mean, the app is called, it's called Heart Shield. You can download it. Uh, And that app, once you give the necessary variables or parameters the program has, okay, it will predict stage wise or which stage you will have or what age you may have cardiac risk. Okay, even for any age group, anybody who enters into that, and the accuracy of prediction of that is 96%. Okay, I know like 4% it may go wrong because we trained that model on almost like 10,000 data sets, basically for Indian population. We have not taken any data from other countries. Okay, I collaborated with a lot of hospitals with all hospitals in Apollo, Medanta, and QARA hospitals, and we collected the data, we trained the models, and we validated them. And I converted that model into an app. That app, I mean, it's more a democratizing of it. It's not I can sell it to a hospital and just do it. But what we felt, our team felt is like, why can't we use, I mean, give it free in the form of an app where everybody from the elite group to the rural look into that app and see what is that risk. It could be cardiovascular, any form of cardiovascular disease. Like it
Mhm.
could be coronary heart failure, like a clots in heart, or it could be some disorders like congestive heart failure or heart attack or cardiac arrhythmias. Okay, any kind of heart attack. Only we need 15 variables that need to be fed into that app.
Okay.
Okay, and that will provide you the probability of risk.
Mhm.
Okay, and it will also tell you at what age you may have it. Okay, and at what stage it will be. So there
Mhm.
will be three classification: the probability, at what age, and at what stage.
Mhm.
Why? Because I mean the app has to be. It was funded by BIRAC. We got the fund from DBT, Government of India, Bharat, where
Mhm.
what we have, I mean, the main important thing is one thing is in India, Indian population at a very young age are prone to these cardiac problems. Okay, in the early 30s or early 40s, the Indian population have this risk, but we are not diagnosed until it goes to some chronic stage. Okay, and during that stage, you see a lot of deaths of young people that are happening because of cardiac arrest, which go undiagnosed.
Mhm.
I can tell you very classical, of course, classical example of the celebrities who had this heart attack or died because of cardiac arrest so early in their career, in their 30s or in the 40s. So in India, the point is like, okay, it happens so early in, I mean, in the age, at early age it happens. Second is it goes undiagnosed. And the third is the progression of the disease will be very fast. Okay, it progresses so fast that maybe in 5-10 years, once somebody enters into 50, you will find this that you can't treat anymore. I mean, there will be what you call the mortality or the fatality rate will be high. Okay, I mean, there were some apps developed by the Western, I mean, US and Europe, but when you take their data and will, I mean, test with our Indian population, it was giving a very wrong interpretation because you understand, because you are there in the clinicals, you understand there will be a lot of difference not only in the variation, genetic variations or ethnicity, okay, uh, from the Indian population, when you look at the races uh, to the Western population. So when you look at, I mean, at a molecular level also, uh, at a chromosomal level, okay, mainly the dominant uh, chromosomes or dominant genes and also some of the variables what we look at will be totally different from the Western population. So it was discussed like why can't we have the data of the Indian population and train the models. So that is what I mean. I'll discuss more with you personally on that.
Sure, sure.
So We'll wait for a couple of minutes and we'll start. Like, I'm going to come out with, after learning what are these AI models, we'll conceptually we'll look into what are these models, for what applications they can be used in QARA, or basically in medical devices, which for which activities that can be applied. Okay. And the second thing is how to work on this stepwise. Okay, stepwise how we can work on it. And the third thing is how the auditors view this. What is the regulatory compliance, as I was talking? What is the regulatory compliance of these models? Whether I'm not pretty sure, like in India, what will be happening. Of course, we have a lot of regulations that have come out, but specific to medical devices, it was there in SOMED, okay, but not on overall AIML. But in Europe and US, if you take UMDR 2017 regulations, there are I mean there are regulations that say that you can do with these models as decision supporting systems, okay, but not the last two models which I discussed, AI agents and agentic AI, okay, because they work more autonomously. Okay, they take decisions and they work, uh, redo the tasks, because there won't be any human loop in that.
Hmm.
So, but the other models, like if you look at LLM or NLP, object detection, computer vision, linear regression, logistic regression, uh, the deal planning models like random forest or decision trees, all these models, okay, almost like 10 models, ML models, can be used in our domain. Okay, once you have an SOP, how you are doing that, okay, how you train it, how you validate it, how you test it. Okay, I'll share the SOPs also, and what is the regulatory compliance and what is the justification you need to give to the auditors. If you have taken the help of the AML, not taking decisions, but a supporting system for arriving at some decisions, because already we said that there should be a human in loop, which is very, very important when we are working with AML platforms. So there are few issues which we need to discuss on the regulatory front. Okay, mainly on the governance, how we are governing. The second thing on the cyber security. Okay, the third thing on explainability of the results that come. You should be able to explain it, not just blindly rely on the ML models. Okay, and of course, the third most important thing, as I every time say, is it should not take decisions. There should be a ground truth, okay, or a domain expert in that field who finally reviews the reports and signs it off, so that he has to take the responsibility, not the machines. So these are some of the things which has to be, I mean, when you go all out, integrating in your organization the ML models, but there will be some protocols, some SOPs first that has to be fixed, okay, and then only you can work on it. So what we'll see today, uh, I understand that some of them are joining now. Okay. We'll go through some of the classic examples where ML models are used in our domain, whether it's in quality or in regulatory or it could be in production. Okay, starting from the simple models like the linear regression, which is commonly used. I mean, we use it knowingly or unknowingly, but when it is deployed in ML machine learning models, the linear regression, it is one of the best models where even auditors appreciate for using that model. Okay, that is the linear regression and also the logistic regression, because these two are supervised models. Because when I say supervised, they are labeled models, okay, that you can work on. I'll show you some conceptual things or where you can work on it. Maybe later after 2 classes, we will do the live sessions. Like we'll have the data sets and how we train it and how we'll validate it and how we test it and how the results will come out and how to interpret the results. Okay. I hope you can see my screen.
Yes, I can see that.
Yeah. See here, I mean, I'll be talking in terms of more conceptual in our domain. I won't be touching other domain because you see, people using a lot of say in all other domains like in banking, retails, automotives, everybody is using them. Okay, because they are not regulated. They don't have much regulatory compliance like what healthcare system has or we have, basically the medical device has. We have an absolute regulatory guidelines standards which we need to follow, okay, if you are using this AI models. And second thing very important is like we are dealing with not some articles or some lifeless things like what Amazon does on online. Amazon uses AIML, I know, like a lot, or like automotives or some retail or banking things. But here we are dealing with patients. We are dealing with humans where patient safety is utmost important thing for us. Okay, of course, the performance of the devices also, and hence we need to be extra cautious, extra careful when we are using these models. Okay, so that these models, when you are working on this, and when you take a decision based on that particular model, what you have seen, okay, it should not have any impact on the patient or it should not carry the risk to the patient. So you should have some guardrails or some firewalls or some governance over it that it won't translate, okay, as a risk or some safety issue to the patient. And that's the main concern, but it's great, like all uh, big companies are adopting uh, in almost all sections of the medical devices, starting from your purchasing or doing the audits to the clinicals, okay, even writing the clinical evaluation reports. But again, I say like it's a human in loop, a hybrid system. And most importantly, I appreciate these models for doing a lot of PMS work on predictive analytics. Okay, like on trend analysis or analytics. And second thing, you'll see it of at most important in design and development. Uh, when we talk of digital twins, okay, and validation of the new medical devices, okay, you need not do all the stuff which we used to traditionally work on, wherein you can simulate a lot of things with ML models and the life, I mean, the time for developing a new medical device obviously will come down just for 2 years or 3 years instead of taking 10 years. And it is also applicable for the pharmaceuticals because they are, I mean, pharmaceuticals, that domain is really doing great work on drug discovery, even on biosimilars. They are doing great work on adopting these models for drug discovery, which we'll discuss. So when I come to linear regression, I said like we will be looking at what are the contexts where we can use these models. We'll take a classical example of that and check it stepwise. Okay, that's the third thing. And when the results come out, what we'll interpret from the results and what is the regulations, what they are saying, and what you will be your role, okay, after doing this stuff. So yeah, Madhusri joined at the right time. Uh, so Madhu, we were discussing on the concept of conceptually how we need to work on this. I want, of course, I'll share this document with you. But once we go into the live models, once we download these ML models or ML platforms, like I said, ML Azure or Colab, Google Colab, like even AWS, that's of Amazon. Okay. Then we will be doing live. I'll be sharing my live screen, like how you need to, uh, of course, I'll provide the data to you. So how you need to integrate the data or get the data into the ML platform. Generally, Excel, we look at Excel, but Excel won't work. It has to be converted into CSV. Okay, CSV file. Once you convert into CSV file, then you need like cleaning up the data. It's like you can't dump everything into the model. Okay, you'll have a lot of missing data, you'll have a lot of repetitive data, or there could be some data which will be scattering, I mean, scattered data. All that, I mean, the machine itself cleans it up. Okay, once you will get the clean data, how to use that data in any of the 10 models what we discussed. As of now, we won't be using AI agents or agentic AI because I said there are long high risk issues with these autonomous models. Okay, they are totally autonomous, like uh, AI agents and agentic AI. We don't want in healthcare system or in our field those models which work autonomously without our consent. Okay, there should be, I mean, somebody who has to take decision, not they do it, take decisions and take up the task. Okay, and actually you will feel very interesting when you work on agents and agentic AI. I mean, not in our domain, but generally, if you see, I work with I mean, I have one AI agent which I work, but that seems to be really more intelligent than what I think in addressing a lot of issues. Autonomously, it does. Okay. But I was surprised how it has got, like, of course, it has a lot of data sets and it is uses a pre-trained data, but it does perfectly. But again, I say like it doesn't fit in our domain because it's autonomous and explainability of it will be difficult. And you can't take clinical decisions or decisions that are linked to our QARA, which are autonomous. So we'll go through the first 10 models, except AI agents and agentic AI. But I have to remind you, I'm pretty sure that okay, next 1 year or 2 years, the agentic AI or AI agents also will come into the medical domain because there will be some regulations that will come up. okay, for governance of AIML or these autonomous agents. Of course, Western countries or these countries are working on the stuff on how to regulate this. Okay, the autonomous machine learning models in the healthcare system. Okay, and I'm not talking about other domains. So people are using it on other domains. I said no, in the banking sector, many are using agentic AIs, whether to giving the CIBIL score and granting the loans or personal loans and all that stuff. Hello. कल सुबह आ सकते, कल सुबह, हाँ मॉर्निंग, या मॉर्निंग मॉर्निंग, ओके, ठीक है, ठीक है, थैंक यू, सॉरी, इट वाज linked to some domestic work in my house. My water purifier, there is some problem. Okay, I mean, what I was talking, yeah, these autonomous things are there in like all domains. Amazon is doing, automatics are doing, everybody using AI agents. Okay, and you actually I posted somewhere in LinkedIn or mold book. Everybody, anybody heard? I mean, yesterday or day before yesterday, we had discussion on this. Mold book is one where it is only for AI agents to discuss. You can't poke your finger in what they are discussing. It's a social platform only for AI agents, and humans can't interfere in what they are discussing. Okay, that's called mold book. You can check in Google and download that. But you can't interfere. You can see how AA agents, 2A or 3, 4, they form a group and they will be discussing on a lot of things on healthcare or something what's happening with the US India trade deal. You give them an option, they will be agents that will be discussing. You give them topic what needs to be discussed, or they will discuss independently anything, the culture, history, medicine, clinical. You find it interesting. That is mold book. Uh, that is a social platform for only AI agents. No human beings can join that discussion. Okay, can enter into that. We need just only to watch it. That's a mold book. I mean, I'm telling you how advanced it is going. Like, not only see when LLM was there, it's although it's a deep learning models, we have something wherein it's more semi-autonomous, where we have to humans are there in the loop. But agentic AI and AI agents are totally autonomous. I mean, that's going crazy. And now we have a mold book where AI agents will be discussing and taking decisions, and we can't interfere in that. Okay, and don't be surprised, like in next 1 2 years, organizations mainly in the regulated segment also use these AI agents, okay, agentic AI for autonomous workflows, okay, with some tight regulations, okay, with some tight governance over that tight regulations, with good, I mean, very stringent cyber security. I know it's going to happen. And the reason why I'm telling is when it becomes autonomous, no, really you can democratize it where you will have a very less oversee on the models. Okay. Uh, you can work on that, but you will have an option of when I say you have such a population and large systems working, some has to make autonomous. It's not always that humans should be connected to every single small decisions. Okay, then only it can be democratized to the last patient or the last village in the country. Okay, and that's one of the aims of democratization of AI in healthcare as per Viksit Bharat, and we are going to see it more. Okay, and coming to our real thing, I said linear regression is the most comfortable, most used, okay, in lot of activities, okay, and the auditors appreciate it, and there is a regulatory compliance for this. I mean, no regulator will question you, no auditor will question you why you have used linear regression. It is a good old model, okay. It's as precious as gold. Like anybody, we keep using it in a lot of things, okay. uh, and as I said, like I'll be speaking in the language of the QARA on medical devices, not moving to the other domains. Okay, I mean, the objective of how we look at this is to understand how linear regression can be used to quantify trends, support risk estimation. See, quantify trends in the sense it could be trends that are coming from your production, your QC reports. Okay, like you can take any trend, like how your supplier evaluation is happening or your supplier verification. You will be having trends of last 10 batches. Okay, your production data of last 10 batches, or your QC reports of 10 batches, or your complaint handling of 10 batches. Some data you will have. When you have those data sets, you can see the trends. I'll tell you what trends mean. Of course, that data you can use in other models also. But we'll see, like, first we'll look into linear regression, okay? And it also supports risk estimation. It helps you in risk management, okay? In estimating the risk, what we call risk evaluation. It's like severity into occurrence or severity into probability of occurrence as per, I mean, as per 14971. But in US, we have a different style, like severity index is, there will be one more additional thing, that is severity into occurrence into detection. Okay, how easily can you detect it, detectable? That we call it as RPN, risk probability number. That can, I mean, this model can give you the RPN, risk probability number, once you have the data. Okay, and like it can give you severity index, that is, I mean, risk index, that is severity into occurrence. RPN is something where mostly, I mean, basically it's used in US only. It looks similar, but they also have the additional variable, that is detectability. Okay, that becomes RPN, risk probability number. Okay, you can use it in risk management and provide objective evidence. See, this is what is important during the audits. We need to give objective evidence when the auditors comes, right? In quality assurance and regulatory without making autonomous decisions. So linear regression never takes autonomous decisions. It's quite simple. I think you can learn this in just half an hour, like how you can use your data, like clean up the data, okay. Then you need to translate your data, or you need to integrate your data in the ML model. Okay, you'll have a linear regression model in that. Once we open Azure or some platforms, there will be a model called linear regression. Then you need to create a project, okay, share your data to that model. Okay, there will be very little things you need to do. Once you share the data, you need to train the model. Like, what is your object? I want to know the trends, or I want to know the risk estimation or classification, risk stratification, a lot of things. Okay, and again, as we discussed before join, like it is a decision support system. It will support taking decisions. Okay, not like autonomously. It will take the decisions and also do the kappa and keep reporting like AI agents. Okay, and it's not a replacement, but it can take decisions. And at the end of the day, humans, I mean, the QARA guys has to take the final call. It can provide evidence generation in the sense it will provide a lot of metrics, performance metrics of the data what you have provided. Okay, and no prediction certainty. I mean, it will not have like others. There won't be any uncertainty on the prediction. It will give certainly that this is going to happen. This is what is the risk probability. These are the trends. So based on the trends, you can predict a lot of things. Okay. When you look at the medical device concept, general and acceptable as per regulatory compliance or even for auditors. Okay, any general active medical device can be used. Okay, anything, any device or any machine that is reusable over multiple operating cycles, because we use a lot of medical equipment or medical manufacturing equipment, okay, which are used, reused, and there are a lot of medical devices that are reused. Okay, in that scenarios, and performance which gradually changes. I'll tell you a contest like how we use this. There is a QARA problem. How does repeated usage after a critical performance parameter over time? Okay, suppose you look at a medical device which has a repeated use. It could be any machine or medical equipment, mainly the medical equipment. It could be a diagnostic or any surgical thing, surgical robotic equipment or a diagnostic equipment. But after a repeated use of it, will the performance will come down of that medical equipment? Okay. Or suppose I say we use a lot of things we reuse. Okay, in the medical device, not only I'm talking about diagnostics or equipment or manufacturing equipment, but in general also a lot of accessories we re-sterilize and use. Of course, we know, but when you re-sterilize and use them, the performance of the device obviously won't be like the first use. The performance of the device will come down. Okay, maybe after third or fourth use. Though we instruct a lot of the clinicians not to reuse. Okay, IFU says it's a single use, but a lot of clinicians reuse, and there is a reason for the reuse also. Sometimes I feel it's good that it is reused till it doesn't come cause any harm to the patient. They re-sterilize, they reuse, or if it is not required to be sterilized, they wash it and reuse. Okay, in during that time, the performance of the devices will come down. Okay. See, here I am taking a classical example, but it has a lot of other applications. The linear regression models in machine learning have other applications, but I want to tell you a model which uh, has an very reasonable, okay, which has a very reasonable context to debate or to take a decision. I said a reusable device multiple times or a machine that is working multiple times to manufacture. There is a medical equipment working multiple times in the diagnostics. There is a device or there are machines that are working multiple times for performing surgeries. Okay, it could be a robotic surgery. But will their performance over a time will drift, will come down? Okay, when I mean here the decision what we need to take is when to stop it not again being reused. Okay, there should be some threshold where the decision has to be taken. Okay, stop reusing it, because as you keep using it, okay, as you keep using it, the performance of it will come down and it may cause risk to the patient. or risk to the devices. So you need to take a call. For that, you can use a linear regression. But again, I'm repeating, not only this, you can use it for a lot of things, as I said, for your trend analysis in production, or in your supplier evaluation, in your QC, in your risk management, in your risk stratification, and also in PMS. So here I am just defining a problem, like when to take a decision not to reuse this, whether it could be a diagnostic machine or your machine that is used in manufacturing, or a machine that is used for measurement analysis, okay, in your company. So what will be the input data? What we want to measure? Suppose, of course, I'll come stepwise. What we need, what is the input data, what we need to provide to this model in linear regression? I will say, for example, I mean, it's a classical example, but the outputs may vary, sorry, the inputs may vary, and uh, irrelevant to the outputs will are. But what is your objective that you need to define? And based on the objective, you need to provide your input data. Okay. First of all, selected performance parameter, it's like, what is the output force? Okay, my input data is what is the force with which a particular machine is working, or it could be, I said, any machine, diagnostic equipment, manufacturing. Okay, any measurable, because it has to be quantified. Okay, non-clinical performance metric is also acceptable. It's non-clinical. You can also pick up clinical also, no issue. Okay, so this is the parameter which we will be providing. Okay, which we will get as an output. But what is the input you need to provide? So the input variable is number of operating cycles. Suppose I say, okay, I have operated this a particular manufacturing machine or diagnostic machine or some equipment 10 times, 50 times, 100 times. Okay, then I'll have some, my output is the force. How much with how much force? Okay, force in Newton or some metrics, with how much force it is working. After 10 cycles, after 100 cycles, after 30 cycles, what is the output force? Okay, that is coming after reuse of the particular machine. Okay, again, I am repeating this, just an example. You can use it in other applications. I'll show the other applications when we go live. Okay, I mean, the data set, sample data set is very simplified. Okay, the X, what we give, like on, you have X-axis and Y-axis, and X what will provide is the device cycle. How many times the device has been used. Here, the device could be your medical devices for clinical use. Okay. But here we are in this context, we are talking example of a machine. Okay. Because the output is the force, what we are doing. So for medical devices, which we use repeatedly, like say you use a lot of catheters or a lot of accessories that are reused, that will be, the data set will be different, that we need to define it. Okay, you tell me what you want to do, then I can prepare you the data set and objective of that. Any company, I mean, we'll prepare the data set and we'll train the model. So it's like a cycle at zero. I mean, you haven't started working on the machine, on the equipment, sorry. So once you install it, you have not performed anything. Obviously, the output force will be 100% because it's new, even haven't used for the first time. Okay, the output force will be very good upon the equipment has been installed, serviced properly. Okay, not still used, not used in diagnosis. or not used in manufacturing or not used in any of the purposes. So then after 100 cycles, 200 cycles, 300 cycles of the use of that particular machine, the output force gradually will come down. Okay, this is the y-axis which we are looking. The output force gradually comes down from 100, say after 500 cycles, it comes down to 90. Okay, it's it's a common sense to understand. Looking at the data, if you see the x and y, it clearly shows as the cycle number increases, the output force keeps decreasing. Okay, there is a relation between these two. And this is an linear relation because as the number of cycles increase, the output force is decreasing. Forget whether it's linear or non-linear, but there is a relation between these two. Okay. So what we need to do here is, okay, it was observations could be no failure. Here we say that it has not shown any failure. After 500 cycles also there is no failure. Okay, out of specs values are not there for your device. Okay, but it is gradual. What it says is that there is a gradual measurable decline. Okay, you can quantify it, but it doesn't talk. The model doesn't talk when you give the XY data, it doesn't talk that it has failed, okay? Or there is it is out of specification. Suppose you are using it for your manufacturing or for some robotic surgeries like, okay, the output force is declining because of some what we call some of the space that are used that are critical in look at some implants or some surgical robotics or in simple medical equipment that are used in diagnostics. Okay, it doesn't talk anything on it failed or it won't take any decision. It is out of spec. But what you get is on observation, there is a gradual measurable decline. You can measure it. Okay, as the number of cycles increases, the output force keeps decreasing. This is a typical QA data, not a failure data. Your QA data may look different. There could be some scattering. Here you have a linear, decline of it, which is happening very linearly as the number of cycles increase. But in some data, what you may have is you may have some discrete data. Okay, where after 200 cycles it may come to 100, or after 500 cycles it may go to 50. The output force suddenly drops. Okay, it may be not linear, it's going erratic. But here it looks like based on it is decreasing every for after every 100 cycles. You can see it is decreasing by 2 newtons. Okay, that is very gradual and understandable. But you will get data in your QC and other reports where there won't be so linearity. Okay, there will be what we call so scattered outlier data. I'll show you some examples on that. Why linear regression is used is in this particular case, this is very important, guys. You need to know which model to use for which data. Okay, it's not like one model fits all data. It's not like that. You will need to have understanding on what are the specific models to use based on your data sets. What is the context of use? What is the objective of use? Actually, what is the data? And what you are looking at, what are the outputs you want? Okay, this relationship, the context of it is here the relationship appears approximately linear, but we don't know, like it looks like a linear one. Okay, objective is trend quantification. You can look at a trend. Of course, we have only XY variable. I'll tell you much more that you can have more X variables. Okay. Suppose I say like now I have only X. Okay. Then to X, I may have X1, X2. I may use another X2. Okay. Which is not only the cycle count, it could be something on replacing the spare part, or it's something on maintenance. You can have a lot of variables, input variables on X1, X2, X3, X4, or you can have X10 also, innumerable variables, but your Y is constant. Like I want to know my output force when there are so many variables, 10 variables, okay, which may affect your output force. If you have 10 variables, obviously they'll have some effect on the output force. That also you can do, but just for you to understand, I have taken only X. Okay, think like it's X1, but the output is here. But when you have trend quantification, objective here is suppose you have X variables, so many 10 variables. The beauty of this linear regression is this model is it will tell you if you have x1, x2, x3, it will tell you which of the variable is contributing more to the output force. It's not that one single x or some single variable is contributing. There are 10 factors which are contributing to y. But in that 10, your ML linear regression model will tell you which of these 10 parameters is mostly contributing to your output force. Okay, and it can give you a grading of all the 10, which is the top 1, top 2, or top 10, or what are the top 5 which are contributing to the output force. Okay, because it understands the data and since we have trained it, okay, it will tell you what are the 10 variables, top 10 variables that are contributing, okay, to your output force. So what information you will have is you will have a particular variable which is contributing like 50% for the output force or 10% for the output force. Then you can rely on the data and see if this variable goes wrong, okay, which is 50% dependent on the output force, or the output force is 50% depend on that variable, then you need to look at the variable more carefully, because any problem with that variable, your machine or a total, there will be a collapse. Okay, there could be a variable which comes in the 10th position. It may not have substantial effect on the output force or on the Y. So here I have just taken this, but as I explained, it also gives the trend qualification, like so many variables give me the risk factors. You have 10, okay, grade me all this 10, which is contributing to the failure. Okay, here it is the output force. Of course, we can explain the key concept, as I said, we should be able to explain the model like how it is working. Okay, you should have a structure procedure, or you can write an SOP. I'll share a lot of SOPs on this. On every model for every activity, I'll share an SOP, like how you can explain this model. And regulatory risk must remain low. Actually, for this, there is no regulatory risk, which is the one most commonly used. If you go into ISO 13485 clause 8.5 on trend analysis, okay, so not on trend analysis, data analysis. There's clause 8.4 or 8.5. In the data analysis, this is the most commonly used model. Okay, we use linear regression mode. So if you look at this step by step, conceptually I'm telling, suppose now I give you a machine learning model now, which has an linear regression model in that. Okay, almost all machine learning models will have different platforms. It could be linear, but which one you want to choose depend. Okay. Suppose I give Microsoft Azure, there will be linear regression models. So you need to pick up that model. Okay, you need to label this. That's why it is called supervised learning. Okay, once you label the data, see, these are my inputs. That is, inputs are X, outputs are Y, but you can have one X. Obviously, the output could be Y only. Okay, but if you want to have multiple dependent variables, this is not the right model. You can go to other models like decision trees where you have more variables or as outputs. But here you can have more variables as inputs. You can have X, X1, X2, X3. Okay, but the output is Y. Then you need to define it and label it. This is my input, this number of cycles. If it is X1, this is my data, X2, this is my data, X4, then what is Y? What you want at the end? Y is the output. I say I want to know what is the output force, because that output force later will tell you whether your device or an equipment is performing well or it's not performing or it is at a breakage. Okay, based on this mapping you can do. The model assumes output force changes proportionally with usage. Okay, this is what we call explainability. The model assumes, it's not me. The model, once it takes up the data, is, I mean, it has a lot of algorithms already built on that. We are not writing any algorithms or codes for it. It's a linear regression model already fixed with a lot of algorithms. We are only providing our data to it, and we have a labeled data. That's what we call it as supervised learning. So the model assumes, okay, you have an output force, that is Y, that is proportionally changing. Okay, proportionally in the sense, as the number of cycles increases, there is a downward shift of the output force, like as I shown. As the number of cycles keep increasing, this causes this, there is a decrease in this. Okay, it could be proportional and sometimes it may go inversely proportional also. Okay, and step 2 is, so first step is define your inputs, outputs, label them, and of course I said, like, first you need to have the data. For you, while we have live training, I'll get you the data from Kaggle, but that is synthetic data. Don't take it as a real data. That's synthetic data for us to do some learning process. Okay. What the model says in step 2, you need to fit a straight line. What is called generally in common language, we call it as a best fit line. The model fits a line that best represents the relationship between these two. Okay, it brings out a line which tells what is, okay, what is the relation between your X and Y. Okay, Y is the output force. Okay, this is the cycle count is X. And those who know, I mean, this is the basic maths which we have studied many a time. It is the equation of a straight line. Basically, equation of a straight line is, okay, okay. Any equation of a straight line, this is universal. Equation of a straight line is y is equal to mx plus c. What is y? Y is the output force. Okay, what is the x? X is the slope. I mean, it's the cycle count. What we have labeled and given it as an input data to it, labeled data to it. Okay, what is m here is the slope. It is the slope. which this slope talks about the relation between x and y, what relation it is having. And it also quantifies the relation. It doesn't say whether it's inversely proportional or proportional. If this goes down, this comes down, or nothing like that. Okay, it quantifies what is the relation between these two in the form of a slope. This is intercept. This intercept you can neglect, but if you want to keep it, it's fine. But basically, it is y is equal to mx. Okay, it's the relation between y and x, and the relation what this is telling is dependent on the slope. Okay, you have fittest lines, best fit line between x and y. Think of a graphical paper. You have x and y. Okay, you have given all the data. This will fit and best fit line, trying to understand what is the relation. And the relation is basically based on the slope. It is quantified relation. Okay. X is intercept. Intercept is the one I'll show you a graph. Intercept which passes through zero. Sometimes you can neglect this, but in some situations, you need. Slope gives the rate of change per cycle. What is the rate of change per every cycle? Okay. Suppose you started from, say, cycle 1 or something like, we have started from 0. Okay. After cycle 1, what is the output force? After cycle 2, what is the output force? After cycle 100, what is the output force? After, say, any cycle you take, after cycle 289, what is the output force? Okay. This slope will tell you, okay, this M slope will tell you what is the rate of change per cycle. Per cycle, for one cycle, what is the rate of change of the output force? You will have that, okay, quantified. So here the model learns two things. Step 3, initial baseline performance. Okay, the baseline performance is 100% as we have seen. Once you have a new machine, okay, you have not started it, the baseline will be 100%. And that's why the baseline basically in the slope, it passes through zero. Okay, I'll show that graph. And it shows you rate of degradation. What is rate of degradation? Because your output force is coming down, some part in your mission is going to degrade. Okay, some part in that any machine I'm talking about, the manufacturing or your diagnostic machines or your QC machines or your diagnostic or some surgical machines. Okay, there will be of course a decrease in the performance of that, and that is attributed to the degradation. Okay, but you know that there will be degradation happen, but you need to understand what is the rate of degradation per every cycle or every time you do a surgery. Okay, what is the rate of degradation? Like people use a lot of these things in diagnostics. After one use of diagnostic, okay, how the machine performs. Okay, obviously it will down, the performance will be down, and you need to understand, but understanding what is the rate is very important. Okay, it understands the baseline performance. Of course, this is not very much important, but this is quite important. And we all should also know what it is, what it does not learn. It does not tell you that there is a failure. Okay, there is a root cause for this. There are safety thresholds. These are, that's why this is more human linked. We need to provide all this. Like we need to provide what could be the root cause. We need to understand. Okay, thresholds, we need to fix it. You can tell what could be the failure modes, but this model doesn't give. The important thing that this model provides you is the patterns. When you have more variables, X variables, it tells you patterns, it will tell you the stratification, which variable is contributing for your performance more, which variable is performing less. Okay, here I have taken some output as a force, but it will if we enter into a real clinical sense or real data with lot of X variables. Okay, I'll show you that also. So the visual representation of this will be okay like this. I'm just trying to though I have not taken this the X and Y variables, but what will happen is as you see the graph, as you see the data, what is happening is as the number of cycles increases, okay, the output force is decreasing, which means it is inversely proportional. It is not proportional, it is inversely proportional. When it is inversely proportional, what you will get a graph like we'll get a negative graph or what we call it as a negative slope. Okay, this is a negative slope. Suppose the graph comes like this, passes through XY axis, okay, through 0. It will be a positive slope. I will show that also. But here there is an inverse relation. As the number of cycles is increasing, okay, the output force is decreased or there is degradation that is happening. So you will have a negative slope. I'll show you a positive slope. A positive slope means both are having a linear relation and proportional relation, not inversely. They are not inverse, like what's happening here. As the number of cycles increase, the degradation is okay. The degradation is more. Or the degradation that is happening is, I mean, when you quantify it, of course, there is more degradation, but what we are looking at that is the output force is decreasing. As the number of cycles are increasing, the output force is decreasing. So X is increasing, Y is decreasing, it is inversely proportional. So you will have a negative slope or negative graph. Negative graph is the one, okay, which intersects on the y-axis. If any slope comes intersects on the y-axis. Generally, the positive slopes will come from here, okay, between X and Y and the both relate. So what this data is telling, okay, you have the model draws the best fit line. Okay, what this model is telling is that all your data points are not on the same line. Your data points, okay, are so scattered because they are not so linear. I'll explain this more as we come to this. Okay, this is what we call as a positive slope. What I showed here is a negative slope because it is inversely proportional. As you keep increasing the cycles, the output force is decreasing. But here it is a positive slope, okay, which means either both are increasing, either both are decreasing. Okay, then you will get a positive slope. I said it will basically it has to go through 0. Okay, that's why I said intercept is 0. Intercept is the line which bisects the x-axis or the y-axis. This is called intercept. So in y is equal to mx plus c, m is important. Y is your output, x is your input, m is your slope. Okay, c sometimes you can neglect it. It doesn't bother like whether it is intersecting. Okay, so what happens is here, what this image explains is each dot one measured data point. If I take this is one data point of total data I have given. These data points are scattered all over, or sometimes they may be in the same line. Okay, This line says it is the best fit line. What is the best fit line is when your data is so much scattered, okay? The model itself gives a line. The hypothesis is like this line is the best fit line, which means that when I say best fit line, which means that this is the only line closest to all points. Okay, closest to all the data you have given. This is the one line, okay, which could be the closest. Suppose you have some scattered here, some scattered here, some scattered here, some are falling on the line. But the best fit line that the model gives will tell you that this is the best fit line which it can hypothetically match that most of the data are near to it. But no, it can't draw another best fit line. You know why? Say you may say that a best fit line may come here. Okay, a best fit line may come here because there are more data points here. A best fit line may come here. But when best fit line comes here, these data points will be very far away. Okay. You may think that there are more data points here. Then the best fit line could come like this. Okay. But when you draw a best fit line here, or when the model draws a best fit line here, because there are more data points here, these data points will be very far away from this line. If you draw a best fit line here, thinking that more data points are here, that will be very far away, so they will be more scattered. So the best line, what it can give, best fit line, what it can give is this one. Okay. See, best fit line doesn't mean that all data points should be on the line. Okay. They should be near to that line. So when you draw a line here, which means these clustered data points are close to the best fit line, and some of the clustered points, okay, are also close to it. So best fit line is the one which is nearest to almost all points. But if you look at the line, you see only 3-4 data points are falling on the line. Still, it's fine. You have, I mean, that is the beauty of this best fit line. It tells you a lot of things. How scattered is your data? Okay, nothing is falling on the line except 4 data points. Okay, there is so much scattering. We call this is totally away. And when this is away, we call this could be a potential failure because so much scattered, which tells that your data never should look like this. If your data looks like this, so much scattered around the best fit line, which means your data is very worst, whether it's your production data or your QC data or your machine data or any data, if it is scattered in such a bad position. Well, just by looking at the graph, you can say this is one of the worst data you ever had. All these points should be as close as possible to the best fit line. Okay, but you find so much of scattering. Okay, and this is also one of the worst. Okay, there are a lot of scattering. You see, this is one. I mean, these are the points which should be interest for a QA, or this is the one point which should be interested. Okay, why it is falling so apart? Okay, see, with this you will get some averages, which I'll tell you. But as QARA persons, you should be interested. Of course, you should be interested in those which are falling in line, which are near. But these are called stray data or total outliers, which are so distant from the best fit line. What could be the reason why these data points are so far away? Of course, they will, if you look at your QC data, of course, this will be a rejected ones. but why these rejections are happening and why this strange data came out, or this came, or this is so out. So there will be interesting point which the linear regression model also tell you why this has happened. Okay, from the best fit line, how far it is and why it has happened. And why others are close and why these 2-3 points are very far. Maybe you can see this data point very far away. We have some clusters that are far. Okay, I'm just looking at only one X variable. Of course, the output is Y. But if I include, I mean, the model, linear regression model, you can include a lot of variables of X, X1, X2, X3, which are dependent variables for Y. Because Y is dependent on a lot of variables, not only on just one X. It is dependent on X2, X3. It could be anything like whether you applied, I mean, the amount of lubricant it has, or I mean, I'm talking about the machine, but you can apply a lot of X variables and then look at the graph like for which variable. See, basically in XY scattered graphs in Excel, if you do, okay, you can look at only one variable. Okay, only this X variable you can look and say, okay, this is why I have one variable XY, that is output force. It is looking like this. Suppose if I have X1, X2, X3, X4. So in XY, I mean, if you enter into Excel and go to XY scattered, you need to do graph for X2 separately, X3, I mean, individual variables, you need to create different graphs. Okay, if you have 10 variables, so X versus X1, one graph, Y versus, I'm sorry, X1 versus Y, because Y is a constant. Y is an output, it is a constant. What is the dependent on, what Y is dependent on? It's dependent on X. If there is only one variable, that is fine. If it is dependent on 10 variables, then you have X1 versus Y, X2 versus Y, X3 versus Y, X4 versus Y, X10 versus Y. So as the number of variables increase, at some point we call it Xn. N is, it could be any number of variables. Xn is equal to Xn versus Y. Suppose if I have 100 variables that are affecting Y, the outward force, then it should, the graph, this model will create a graph, okay, where you have, say, it could be X1, could be X2, something like you run up to X10, or you may go up to X100. So there are 100 variables which are affecting your Y variable. And Y is the output. In this context, it is some output, but I can tell you a lot of examples. In this situation, you can't use Excel. So if you use Excel, you need to create 100 graphs. But Excel will create, I mean, this ML model on linear regression will create, okay, one graph, okay, multiple graphs, because it undergoes a lot of iterations, okay. And here it will tell you like which variable, if you take X1, okay, take X2, or take X10, or take X100. See, I'm talking of so many variables. X1 you may have for X1 so many data points. Okay, like how we had here, there are so many data points for X. Okay, I'm taking only X here. think that this is x1 for practical example. Okay, y will be constant. So x1, only for x1, I have some 5 or 6 data points. Generally, you should have more data. If you have more data points, that's fine. So for x2, you will have so much of data points. Okay, could be 50 or 100. x3, x4, you'll have x100, lot of data points. And how all these are linked to, what is the relation of all these 100 variables to y? It will be dictated by the slope. Okay, some you may have a positive slopes like this, some will have a negative slope, some slope will be so erratic, what we call non-linear slope. Okay, non-linear kinetic, it won't be linear. If it is not linear, you should not use this linear regression. Okay, if the data is not linear, which this model will tell you whether it is linear or non-linear. If it is non-linear, actually your model won't fit here. You won't get a best fit line. Okay, then you need to move to other models. So what it does is, it will also tell you, okay, what is the relation between x and y, and if you have more variables of x, it will tell you the relation between of all the x n variables. We call it finally xn. Okay, n could be any number of variables, I don't mind. Okay, then what is the relation of this with y? What is the y? It will tell you a relation of x1, x2, or x2 with x10 or x, any number of variables. It will tell you what is the relation. And it will also quantify what is the relation, okay, in the form of slope. Okay, slope is the one which quantifies the relation between these two. Of course, the graph will tell you it's directly proportional or indirect. If you have a negative graph, okay, like this, it is inversely proportional. Okay, as one is increasing, the other is decreasing. If you have a graph like this, okay, it's a positive graph. Both are following the same pattern. But most important thing I want to tell you in linear regression, that is very important in this model. It will tell you which variable x1 or x2 or x10 or x100 is contributing more to y. Okay, y may be anything. Since it's an output force what we are taking, it will tell you what is the percentage of x1 contributing to the y. Okay, it may be contributing more or it could be less, 5% or 10%. But somewhere you'll find in these variables, one x or one variable, it could be x10 or x18 or 19. Okay, which could be contributing more to y, whether it's the force, output force, or your degradation or something x, something of x, which you want it as output. Okay. So you can stratify this like in risk management. You can see like, okay, I have a device failure and I have so many variables. Can you tell me which variable is contributing? You will have a lot of data. So it will tell you like 50% of this is contributing for the failure Y. And some may not be contributing anything. Some may contribute very less. So you can stratify risk quantification. Here you can tell so many other things also as I go. So I said each dot one measured data point. I said here output for that is y is equal to, okay, mx plus c. If you look at y is equal to mx, this is, see here the intercept is 100. Intercept is 100 because at 0 cycle the force is 100. Okay, because you have not started working on the machine, that's a new machine. So before starting the machine, that is, no cycles have taken place. The device cycle has, it is brand new. Whether the equipment or the machine or your device is brand new. Of course, it performs 100% if it is brand new. Okay, so that is why intercept here, okay, will be 100 because it passes through straight line. Okay, it passes through a straight line. Generally, it has to go through the straight line, wherein the value of here will be very 100. Okay, suppose I maybe Excel I can draw this graph. But this has to be in Excel. But I'll not can't try. Anyway, I'll tell you this. I mean, it's all of you guys know, but how to interpret this is very difficult. Maybe next class we'll work live model on linear regression and also on logistic. We'll download this, download Azure ML and we'll work on it. Okay. I mean, I'll show it somewhere. Uh, So the most important thing is like it gives you a stratification of risk. Like if you have 10, 20 variables, it can tell you which one variable is contributing more to your output, whether your output is a failure or your output is a rejection or your output is something that is causing degradation or your output can be some PMS data. Okay. And as I come to more complex models, you can have more Y variables also. You can have, I mean, these are more complex models. This is linear regression where you can have more X variables, only one output. Okay. But with that Y variables also, I mean, you can't do simultaneously all this. So what you need to do here is, I can show it better in live. Because you have already derived at what your output is. Suppose I have these variables. Okay. Then I can ask what is this relation of this variable if I am connecting it to another output. My output is different. Okay, I want Y2. Well, okay. Then what is X1 to Y2? This is another output I want. It could be anything like the degradation. Okay. So you can work on Y1 separately. You need to you need you can work on Y2 separately, Y1 separately on different variables, or you can mix it up in linear regression. And the beauty I said is it can perform a lot of tasks. Can tell you what is the relation of X1 with Y, X1 with Y2, or you have X2 and Y2 or X3 and Y1. So suppose I want relation of X10 with Y2. It will show what is the relation. Suppose I have X1 with Y2 or X10 or something like X10 I have what is the relation of, because these are different variables. X is your input, Y is your output. What is the relation? when you establish a relation in the form of a slope, you will really understand, okay, how they are connected, and you can quantify their relation. See, when I use the word quantify, that is very important. As I come down, you can understand what it speaks, what is the interpretation of the outputs. Okay, intercept is, I said, since it is a new machine, or in this particular example, it is new. At 0, it is 100. Okay, 0 in the sense 0 cycle means it has not started. Okay, practically we say that it's a new machine. So the output force is 100. Anyway, for any new machine, it will be 100. It performs better. Meaning expected performance at the start of life. Okay, this is expected performance at start of life, that is at 0 cycle. It's 100. Conforms design baseline. This is a baseline of the design of your, so it is performing well 100% before you start using it. Supports design verification evidence. Okay, what if you have the design data, then if your intercept, okay, it is passing through 0, which means your device is performing well. It is performing at 100%. Okay. And I mean, I said you can use a lot of data on this, but what this slope is telling, okay, this slope is telling, if you look at the data also, it will appear. It meaning what is the rate of degradation, okay, and what is the quantified trend? Supports risk probability estimation. Suppose what is the slope telling is for every cycle, okay, because it is a negative slope, okay, as the number of cycles is increasing, okay, the output force is also decreasing, okay, so you will get a negative slope, that is, it will be minus, and per every cycle the output force is degrading by 0.02. If you look at this data, we have taken not per every cycle. Okay, we have taken from 0 to 100, 200, 300, 400, and 500. And this is the output force which is decreasing by 2 newtons. Okay. It is gradually, after every 100 cycles, it is decreasing by 2 newtons. But what is happening after every cycle? Okay, after every one cycle, I'm not talking about 100 cycles, I'm talking about every one cycle, it is decreasing by 0.02 Newton. Okay, that is what the slope is telling us. The slope is telling us that after every cycle, though my data is in 100, 200, 300, 400, and 500, but the model will tell you after every cycle what is the degradation in decimals. Okay, the degradation that is happening per cycle is minus 0.02 newtons. So after every cycle, it is decreasing. It is negative means it is decreasing. It is inversely proportional. So the force is decreasing. And if you multiply it by 100, it will come to 2 newtons. That's what we have shown in the table, that after every 100 cycles, it will decrease by 2 Newton. Simply to say, after every cycle, it decreases by 0.02 newtons. Okay, I mean, this is a very simple common sense. That's why I've taken a very simple example, but as we practice, we'll go into more complicated things. It is negative because it keeps decreasing. The meaning, the rate of degradation, it is showing some rate of degradation. The output force is coming down. Okay, you have a quantified trend. 0.02 is quantified one. Supports risk probability estimation. I'll tell you how it supports risk probability. at which cycle you are entering into risk. Okay, suppose I have gone into 500 cycles. Okay, what is the output force? Suppose I have done 10,000 cycles. What is the output force? It only provides us, okay. Slope tells how fast change is happening, but it won't tell you whether it's failing or not. It is our decision to say when it fails. It will only tell you what is the change happening, okay, in between those two. X and Y, what is the change that is happening? We see that as the number of cycles increase, there is a decrease in force or there is a degradation. Okay. So where you can use this, okay, you can use this in risk management. I said severity, probability, okay, PMS trending. I'm just reading this here where you can use linear regression. But when we go live, I'll show you examples of how you can use in risk management, how you can use this in PMS trending. Okay, how you can do is in COPPA justification or preventive maintenance or COPPA. You can use also in trend analysis, also helps you in preventive analytics. Okay, and you can also use it in management reviews. I link all that. You should also know like what linear regression does not do, does not predict failure, does not define acceptability limits, does not take decisions. That is really good. You should not take decision. It does not replace engineering judgment. Okay. So here the model only informs couple of things. What is the relation between y variables and x variables, or your input data to the output data? You may have multiple x variables, only one y variable, or you can have multiple x and y variables. It's tell you what is the relation between these two. Okay. And if you have, as I said, more y variables contributing to, sorry, more x variables contributing to y, it can, okay, stratify it based on the risk, okay, which is contributing more to y, whether it's some good thing or some bad thing on risk. Okay. And it can correlate what is, if you have more y2 or you have a lot of x variables and y variables, it will correlate all of the x variables to y variables. Suppose you have x1 and x10, it can correlate, okay, and tell you what is the relation. And to me, the most important point here is it quantifies the relationship. Okay, it just doesn't say it is linear or non-linear or inversely proportional or directly proportional. It tells you, okay, though I provide data at 0, 100, 200, 300, and 500, but it will derive at a conclusion of every cycle and gives me a quantified relation between these two x and y, which will be helpful later for me to draw. Okay, once I have the slope or the relation quantified, I can do a lot of calculations. Maybe I think I'll check it when this output performance or output force is coming down to 50 or 48. Okay, I'll take the call. I'll tell that, okay, once the output force comes to 48, you stop the number of cycles. You stop manufacturing or you stop the diagnosis, or you are maybe in the complaints also or risk stratification. It's fine that after this, you need to do a COPPA. You need to do a root cause analysis because you cross that severity or probability of risk. As I said, risk index, you take risk index as y. Okay, then you have x1 is severity, y is probability. Sorry, x is severity, x2 is probability. So you have x1 and x2, severity into probability. Y is the risk index. So you will have some data based on X into Y. What is the risk index? Risk index is quantified because its severity into occurrence you can multiply, you'll get risk index. Okay, but based on the risk index on severity into occurrence, where you have in the risk management table very well defined, okay, on the probabilities and also on the severity. Once you multiply it, you will get risk index. But you can stratify this, like how is the risk index of your complaints, where they are in green zone or in the yellow zone or in the red zone. Or if this, you can also give an threshold. If it crosses the green zone, then immediately you need to do a cop-off. Or if it is in a red zone, okay, I mean, if the risk index enters the red zone, immediately you need to recall or stop your production. Okay, if it's in yellow zone, it is safe, but you need to start working on root cause analysis and cop. Okay, if it is in green zone, but still you can work, but not so serious. Okay, I'll tell, because here you have two variables of xy and sorry, x1 and x2. The outcome what you're looking or the output what you're looking is y. Y is risk index or risk estimate. Okay, if you are in US, you will have x1, x2, x3. You will have three x variables. Because in US, we'll have severity x1, okay, probability in x2, and we need to do detectability x3. So it is x1 into x2 into x3 is equal to y. Y is RPN. In India and Europe, we call risk index. Here in US, we call it as risk probability number. So if you have a number, then you have complaints, you just keep multiplying x1, x2, x3. And at certain point of risk probability number, if it crosses, okay, then the risk level is either out of your hands, or if you map it, if you have the heat map, it will be on in red, or it is going into green, or it is in middle in between, okay, yellow. It will only do the risk stratification. Okay, anything, any risk that you give, it will stratify it. Okay, and also on the PMS, okay, I've given a lot of examples. Okay, it will predict the probability in the risk. Okay, risk is not quantified, not assumed. I mean, risk is now quantified. You can quantify risk. How you are quantifying risk? Based on the slope. Slope is one, slope is quantified. Okay, you can quantify everything. It is not assumed. Earlier we used to assume that this may have risk, this may not have risk. So now everything, once it is quantified, that's, I mean, looks great. Okay, PMS trending, like suppose you have PMS on your complaints or customer feedback. Suppose if you have 100 customer feedbacks, there could be one output. You can have multiple outputs. You have 100 feedbacks. Say the output may be good, bad, or average. Okay, and overall or individually also you can look at those. Suppose how is my packing, my device packing. Okay, some may say good, bad, so and so, or you can also have some grading like 1, 2, 3, 4. Or on a scale of 10, you can have a scale of 5, you can have. Okay, then you have a variable like how many have graded it on your packing and everything on your procedural success. How success was your device? Okay, on the feedbacks, customer feedbacks, or you can have clinical success, procedural success, the failures that you have, okay, the recurrence of the failures. If you look at the complaints, okay, that's important thing in PMS training. If you have the complaints, okay, then you can not only do the risk estimation, risk classification, all that, you can understand based on the patterns like how the risks are linked. You have 100 complaints. 100 complaints may not be linked to one thing. There will be different complaints. Okay. Then you can look at what are the different complaints. Suppose there are 10 complaints because of one issue, there could be 20 complaints. So you'll have different variables, X1, X2, X3, X4, wherein you have different complaints. Okay. Then based on the complaints, you have an Y. Basically, you may say that Y is my complaint rate or Y is my complaint. Then you do a linear regression, then you'll find or you can find out of this X1, X2, X3, which you have more in occurrence, which are more clustering in one group. Okay, and what is the rate at which they are happening? Okay, rate in the sense occurrence, because I'm looking Y as an occurrence. So I have 100 complaints, Y is my occurrence. Suppose Y is my risk index. It will tell you which complaints have high risk index and you can quantify it. Suppose I have only severity as Y. You have a lot of X. And it will tell you which one is of high severity. And you know the rate of quantify. Okay, you can look for severity, you can look for occurrence, or if you want in combination Y as an severity index, you can know it like which complaints are having more severity. What it tells you is the pattern, like you have lot of risks, okay, could be of less occurrence, high severity, okay, less severity, more occurrence, okay, it will tell you a pattern and it will also tell you what is the risk index, how much risk they are causing, whether they are in green, that's a safe zone, yellow, maybe time for action, red, danger zone, red flags. So where you need to act, that will give you a trends and you can expect, this is what is, I mean, it's more complex than what I'm saying. This is what you can do based on the trends. You can do a lot of predictive analysis for what is going to happen in your next batches. Because you have a pattern here. Suppose this pattern is available for you for almost 10 batches. The same pattern is available. So you include all the 10 batches in a single data set and look at the graph and the pattern. Then your predictive analytics will be that it will perhaps, if you have not taken any action for the next, okay, the 11th batch, you will have the same complaint, same severity, same occurrence, same risk index. Okay. PMS trending and COPPA justification or preventive action. If slope increases over time, okay, there is an increase in slope means, see slope here we need, what slope means here, the angle between, okay, this straight line and x-axis. What is the angle? Okay, is the slope. But basically we quantify it. If I look at this angle, won't be 45, or it could be somewhere around, yeah, 45 or 50 degrees. But I'm telling in degrees, but the model quantifies what is the slope by equation of a straight line, y is equal to mx, because you have y as an output, x as an input, m is slope. When you know y and x, it's easy to calculate m. But when you have a lot of thousands of data points, you can't calculate for each and everything. So the model will calculate overall an average of the slopes of between x and y. So it will give you 0.0 or some slope which can be quantified. So when I say the slope increases. Okay, the slope increases means the slope will drift towards the y-axis, which means as the complaints keep on increasing, think that this is your first batch. If the slope goes somewhere more drifting towards your y-axis, okay, which means that your complaints are increasing. Okay, the slope keeps increasing. Suppose think that this is 45. I mean, just think like the angle between this x and angle between this line and x is 45. If there is some line that comes in your next batch like this, so the angle will be 60, which means though they may be linear, but your complaints keep increasing. So your slope increases. When you quantify the slope, instead of 0.02, it will be 0.04. So that is what you can do it for every batch. Okay, separately, every batch you can quantify what is the complaint rate, what are this, I said, occurrence, severity, risk index, predictability. Okay, individually you can do for every batch, or you combine all 10 batches, you can do it, or you want to do it separately for 11th batch. Okay, after doing 10 batches, you can do, but you can predict a lot of things. So as the complaint rate increases, that is what is telling. The slope increases over time. Okay, when I say slope increases, now the slope is at 45 degrees. The slope increases means the slope slightly moves towards the y-axis. Okay, if it is moving towards y-axis, which means there is increase. Okay, you need to do an investigation. Okay, now COPA is, it is data driven and not reactive. You are not reacting to the data, you are proactively looking at the data. It is data driven. You know the predicate analysis, you have quantified a lot of things. Okay, you have done so much of mapping. Actually, if I show this in the live ML model, you'll appreciate it much. Okay, and some, mostly for all models, this is human decision has to be in place. You have to define acceptability limits. I mean, it won't do it. We need to define all this. Okay. So I said it can't replace the humans. Okay. It will help in as a decision support mechanism, but not. Okay. And the limitations of it assumes everything to be linear behavior. But if you give any data which is not linear or what we call erratic or not kinetic, non-kinetic and non-linear, we call it as first order or zero order or non-linear. Okay, it assumes there will be some relation between those two, but if there is no relation, we need to switch to other models. It cannot capture sudden changes. That was I said. If suddenly it from 80 it goes back to 50, then the graph will move upwards. That is something erratic which you don't expect it. That is absolute stray data. Okay. It is very sensitive to poor quality data. Okay, this is the limitation. If you have poor quality data, it will become more sensitive. That's why you have a lot of scattering all over this. The data is not good. Not suitable for complex interactions. That's what I told. Still, you can do it if you have multiple variables in X, multiple variables in Y. Okay, if there are 3-4 variables in X or 3-4 variables in Y, it's good. But you have large data sets of X variables, large data sets of Y variables. Okay, in X you have X1 to X100. Y you have Y to Y100. It becomes so complex for this model. I know like it can't do. We need to move for high, that's where we need to use deep learning models like the decision trees, or the random forest or convoluted neuronal networks. Okay, that's for the large data. This is very simple. As the most simplest one in machine learning is uh, linear regression. Actually, I mean, I never do linear regression in ML models, machine learning models, because if I look at the data, I can interpret a lot of things. Just by doing an Excel graph, I can interpret a lot of things. How much is the data? I mean, I don't worry about the quantity of data. It's a large data set also, I can interpret a lot of things from the data. So I don't use linear regression, but you can start using, because this is the most common use. Regulatory compliance is there, auditors appreciate, and it is there in our ISO 13485 clause 8.4, somewhere there, data analysis. So you can start, I mean, you will get lot of outputs from this. Okay, the more is your data, the more your variables, the more interesting outputs you get. See, I told you, you can use in all this. Okay, risk management you can use, PMS trending you can use. Okay, COPPA justification or preventive action you can use. You can also use in management reviews. Okay, but we'll limit management. That's not much we can use in management reviews. It will be more visual, object and everything, but I'll also show how you can use it in management reviews based on the previous data. What is the one, again, it tells us what is the one which is constantly discussed in management review, but no action taken. And you have not taken action, it has come as a complaint. So there will be a linkage between all this. Okay, today I'll stop. But next, say for auditors, like linear regression is very transparent. It is explainable, simple assumption, traceable data, conservative interpretation. You can interpret it easily. Okay, red flags occur only if results are overclaimed. Well, this lot of people do this. More than the results, they overclaim. They claim more than what the results show. I show our complaint rate is say 0%. Yeah, I mean, you should not overestimate that you have no complaints. Or if your data, generally data are linear, that model doesn't tell you you have zero complaints. And that's what I told. It won't tell you how your complaints have. It will give you a defined relation. It will quantify what is the relation, but it won't tell you have zero complaint. Okay, and you say that it is an autonomous. I said we never use autonomous till if you are in contact with me for this year ending, I'll tell you like how agents, genetic AI will work in QARA. Because they are autonomous, and I am pretty sure I spoke with Susmita earlier that end of this year you will have a lot of autonomous models that will come in. Okay, but don't worry, your jobs won't go anywhere, because there also you need to design it, you need to take the final decision, and you have to be the loop in these autonomous systems on decision making. I'll tell you on that, because currently I use one AI agent and I have a lot of problems with it. Okay, which I don't tell also it does. Okay, mainly on replying to, I mean, I don't use in this domain, I use it for general personal use. Some it replies email, some it replies to WhatsApp, I mean, which is not under my command. It does autonomous. And some good thing what it does is it picks up all the updates that are happening in healthcare, or if I define like give me only on QARA, it gives me the updates. Okay. Sometimes it gives what are necessary, sometimes it gives some stupid unnecessary updates. So there is a mixed opinion for me on AI agent. But let's see if it is more transparent and regulatory compliant. We can use that will happen once you have regulations coming out. Okay. See, to partisan, what does the slope represent? It quantifies the relation between x and y. Okay. For every single point or every single cycle, the slope is very important. If slope doubles, what does that simplify? If slope doubles means you have more complaint rate or the degradation is amplified. I mean, 2 times it is amplified, or the complaint rate has increased by 2 times. Okay, if the slope doubles means the slope is moving towards y-axis. Okay, if it's moving towards x-axis, which means the complaints are the slope is coming down. If it is 45, you can see between x and y-axis. If it is 45, it will intersect. Okay, like a straight arrow going through 0. Okay, between x and y. If the slope falls towards x-axis, which means the slope could be less than 45, it could be 30 or 20. Okay, which means the complaint rates or the degradation or something is decreasing. But the slope is moving towards y-axis. That's the vertical line. Okay, which means the complaints are increasing or something stupid nonsense is happening, which you need to trace out. Okay, always slopes flexing towards the horizontal line, that is y-axis, are good. So it's traced towards x-axis, the vertical line. Okay, I mean, it is depicting that as the slope increases, you have a lot of problems. Okay, would severity change by what is this? If slope doubles, what does imply? Yeah, it implies that the complaint rate has doubled. Could severity change? Why or why not? Obviously, the severity will change. Okay, because we are looking at risk mitigation or risk index as severity into occurrence. Yeah, we may go either way. Severity may be the same, only occurrence increases. Still, the risk index increases. Okay. The severity may not change, but if the occurrence increases also, the severity increases. Okay, because risk index is severity into occurrence. If occurrence increases, severity is same, occurrence increases, your risk index will increase. Without change of severity, the occurrence increases. So your risk index will increase. Okay, this enforces risk-based thinking. So linear regression does not predict failure, it quantifies change. So you need to, this is where you need to be in the loop. QARA guys, you need to understand or predict the failure. It won't do it. It will only quantify changes, how tell you the relation. It will tell relation between multiple variables. It can stratify in risk management, PMS, COPA, a lot of things. Okay, linear regression converts raw performance data into an explainable trend that QARA can use for risk, PMS, and preventive action without increasing regulatory risk. Okay. Yeah, I hope you understood something, but I'm pretty sure once we do a live thing with some data, okay, you will enjoy it. Okay, you'll enjoy how it interprets the data and so much of outputs you get. Okay, absolutely. Not only you enjoy, you love it. You love doing this. Even for linear regression. See, I love doing it for more deep learning things. But linear regression, even you like the logistic regression because it's more of a classification. Okay. Well, the next class I will discuss. Of course, I'll share some notes on linear regression, practical examples which I have done. Okay. we'll call it a day.
Thank
And
you.
yeah, let's meet next Wednesday. Or if you want a session on Sunday, I can.
No,
Because we, yeah, if you don't want, that's fine. Because once I tell you how to go through the live sessions or work on live sessions, my work will close. You can keep practicing. Okay, if you have any doubts, then you can come back to.
yeah.
Yeah,
Then
for
we'll,
next session, then you'll be giving demo of this, sir.
yeah, no, after completing logistic regression, because these two are supervised learning. See, supervised learning is easy. Like you can label it. I know what is X, I know what is Y. Okay, or if there is lot of X variables, I know them, I label them. See, that is supervised learning. You know what is X and you need know what is Y. So it will become easy to complete linear regression and logistic regression. But once you enter into unsupervised, you don't label, you get data as such. You don't know what is the relation, how to fix the relation. It will be more, it looks like patterns. Okay, you won't get any straight lines like this or bar graphs, something like that. So this, after completing logistic regression, we'll go through the live session. So once we complete, I mean, that's on supervised learning. So once we enter the unsupervised learning, you need to have more understanding. Okay, it will be bit complex models. Okay, whether you do, and as we enter into object detection and computer vision, still it will be more difficult to understand. Okay, and NLP are easy. NLP LLMs are easy. Then, I mean, the more main focus will be on the deep learning, on decision trees, random forests, LLMs, NLP, object detection. Object detection and computer vision are basically used only in QC, but we'll check it out. Fine, take care. See you on Wednesday. Madhu and Leela, bye.